Guys, what's going on? Dr. John here. Welcome to the Garden Medical Spa podcast. Here we are with another episode, and we're with a very special person, and her name is Maia.
Hi, everyone.
Maia is a fantastic esthetician, medical esthetician at the Garden Medical Spa, and she works primarily at the Northfield office. Yes. And you're also where, Maia?
I'm in Voorhees on Mondays.
Cool.
Yeah.
That's awesome.
Yeah.
And you've been in Northfield for a little bit of time now.
Yeah. I kind of flip-flop back and forth from Northfield and Voorhees.
Yeah. Do you like Northfield?
I do. It's like my favorite office.
It's one of my favorite offices too.
Yeah.
Yeah. You'll find me there on Tuesday. So you'll see both Maia and I there on Tuesday working together. And if you enjoy what we have to say today and you want to talk more about it to us in person, you can see us there on Tuesdays. And you can see her on the rest of the days. Mm-hmm. Even better. So we invited Maia onto this podcast today because we wanted to talk about your journey. Yeah. Like the Maia journey.
Okay. And I love that.
It's a great thing. So it's all about you today, Maia. And it's, it's the life optimization journey. Yeah. That's, you were kind of like in the beginning of it. Yeah. And we developed a game plan for you. Mm-hmm. And take us through it. I guess like when we met, you were so, you're still young. You're 24. Yeah. How old are you?
I'm 24.
You're 24.
Yeah.
We met when you were 22.
21, I think.
21?
I think 21.
Yeah, you were just a little baby.
Yeah.
Yeah, man. That's awesome.
I know.
You were just like fresh out of school.
Yeah.
Amazing. Yeah. And Maia's actually the cousin of Dana,
yes.
Who's one of our master medical estheticians.
I know.
She's fantastic. I've known Dana for a long time now, and she's over in the Cogswood office. But anyway, that's actually how Maia was introduced to us. And Dana vouched for her. She's like, listen, my cousin's the best. I said, listen, Dana, you're the best. So if you say that about your cousin, then
I know. I was
she's
freaking
hired.
out over my resume for like a week, and you didn't even read it.
I don't think I read a resume.
No, he had like a piece of pizza hanging out of his mouth in our interview.
I did do that. Mm-hmm. Yeah, it was very informal. And but I was like, wait, are you the one that's cousins with Dana?
Yeah.
and then you were like, yeah, and I was like, okay. And I think I was like, go talk to whoever, and I've got your contract signed. Yeah. Yeah, that's what we did. That was a good interview.
It was.
Yeah, easy.
It was quick and easy when I was like sweating for like a week over it.
You're all nervous. That's so funny. So what got you? What made you pursue our life optimization program? Like, where were you at when we first met, and where are you now? Take me through it.
Yeah, I would feel like I was definitely suffering with like inflammation for a while. I have Hashimoto, so with like that autoimmune and just everything like that, I was just dealing with like a lot of like puffiness. I was definitely making like the wrong choices in food, I think.
Did you think you were like maybe absorbing food poorly or whatever? Did you have some problems with that? Or like food would just sit differently? Yeah,
it was definitely within like 2 years. I feel like the way my body changed was like crazy compared to what it was when I was like even 19. It was so different.
It was different. It was acting different.
Yeah.
And it was like snowballing?
Yeah, it was ridiculous. I feel like it happened so fast.
I feel like this is a common story amongst a lot of the clients that we that we talk to, especially younger ladies, and I'm not sure. I mean, there's a lot of different theories. I happen to think that it's not so much the food itself. It probably is the food itself. Yeah. I shouldn't say that, but I think the pesticides that are being sprayed on the food. I think that leads to probably a abnormal way that our gut interacts with it.
Absolutely.
And I think that leads to weird digestion things. I mean, in regular medicine, not to sound disgusting, but I mean, constipation is like a gigantic problem in the United States.
Yeah.
Actually, maybe around the world. I don't really know. I don't practice medicine around the world. I practice medicine in the United States, but that's a huge problem.
Right.
And, you might say to yourself, like, all right, well, maybe it's just the American diet. Is it just the way that, is everybody inflamed? Is just movement? Anyway, I'm not going to get, we're not going to get stuck on constipation. Let's get away from that. All right.
Okay.
Yeah. I got off on a tangent. Anyway, so here we are. And you things got out of control. They snowballed for you.
Yeah.
And how did you get introduced? I guess we talked about it.
Yeah,
we talked about it. Yeah,
we talked about it upstairs.
Oh yeah, because I was taking care of you. I did a medical visit with you. Yeah, like a legit medical visit.
Yeah, my thyroid was just all out of whack.
Yeah, we kind of got down to business. We came up with a game plan, and we got a game plan going. Yeah, and part of that game plan was that our life optimization program. Yeah, and have you noticed? Since being on, what did that entail for you? What's the main component that's been helping you?
Definitely when I was on the GLP-1s, and then definitely switching to like an anti-inflammatory diet. The past like month or two, I've been treating myself a little more, but for the most part, on an anti-inflammatory diet.
Yeah, that's awesome. And we did like a micro dosing of the terzepatide a little bit here and there. Yeah, and that's helped you like tremendously.
So much.
I think it was really amazing because once you got on that, there was a very clear change in the way that your overall appearance looked. Like you looked brighter.
Thank you.
Yeah,
that's so sweet.
Yeah, for sure. And it was like pretty quick, and that's something that's like actually been replicated amongst lots of people that are on like this microdose. And I was telling I forget who I was telling actually, but maybe multiple people, because I talk to lots of people all the time. I say the same thing, but I think that terzepatide and the way that we've developed it and use it for women, for women especially that are in your age group, say like 20 to even my age group in their 40s, I think microdosing terzepatide acts very much how testosterone acts for men. And let me explain that. So testosterone, when you give a man testosterone that has low T, they get this global like wellness feel.
Yeah.
Everything's like a lot better. You know, they're like, they have more energy. They are healing better. They have better sex drive. They have better ability to build muscle. Just all the things. They're actually thinking better. So it's that global effect. It's pretty cool to see a man that has low T go on T and they like become revitalized. Yeah. It's really amazing. And we offer that too. Just saying. Anyway, but for a woman, I feel like women deal with like cortisol stresses. I think there's a perimenopausal component, not for you. I think there's I think in our life in the United States, there's just plenty of cortisol always being, delivered. And I think that with this microdosing, it helps people deal with and actually block those bad effects from these different chemicals that are probably inappropriately made just based on the environment that we find ourselves in. Yeah. And I think that why I was so excited for you to be on this is because it's like you can speak about that journey. Yeah. And like the hardships that you went through. Mm-hmm. And then by just incorporating this one little thing, kind of like turned it around for you.
Exactly. Yeah. I know. I couldn't be like any more happier with myself.
What did you feel like this global thing that I was talking about? Does that kind of resonate with you, or am I off with that?
No, I don't think you are. I feel like when I was like during this like whole process, I was doing a lot of research about like the foods that we put in our body, and it's kind of gross, like everything, like just learning about the process stuff, the like seed oils and just all that stuff.
Kind of crazy.
Yeah. Pesticides. It's like never ending. You like can get stuck in
it's almost like impossible, right?
It is. You have to like.
Do you know what I foresee this the terzepatide and also retatrutide coming out? Like it's going to be out soon. We have some of it actually available to those clients that are interested. But the terzepatide we'll talk about now, I think that in the future, it's not going to be used as this weight loss thing. It's not going to be like marketed that way. I think it's going to be used as a metabolic enhancer. Yeah. And maybe a metabolic healer. Yeah. So like, it's going to get people kind of like have their hormones like, check out, get rid of some visceral fat, maybe, which is like inside fat around your organs. Right. And then just get you overall like metabolically correct. Yeah, absolutely. And the way your body interacts with glucose or glucagon, and like the storage units of glucose.
And I think cortisol is tough to get rid of and it's like lower impossible. And stuff like that. Yeah.
And the phones aren't helping and that kind of thing, right? What's your favorite thing about being an esthetician?
I love, it's so like cliche, but I love helping people.
That's the best.
I know. I love being in this field.
It gives you purpose.
And I love being in like the medical aesthetic side. And never going into school, I never wanted to do eyebrows or eyelashes or anything like that. I always wanted to work at the garden.
What was it that drew you to the garden?
Dana. Yeah. Yeah. Nothing. No other reason besides Dana.
You knew me.
I did.
Your cousins.
Hello. I know.
No, I'm messing around.
I know.
No, I mean I did, but yeah.
But when I was in school, everyone only talked about the garden. I was and nice. I would just like keep myself quiet. I'm like, I'm gonna work there. No one else is.
That's right. Keep it on the low. Yeah. That's awesome, man. So like, what's one of the best stories since you helping people and stuff like that? Yeah. I don't know. What's a good story that you have that you brought somebody to a cool place and it was like and it felt good for you?
I think we had someone yesterday. She has breast cancer, and she was dealing with sebaceous hypoplasia, and we put her on a few products, and we didn't do any treatments on her yet, and she was just so ecstatic to me and Gianna yesterday, just
awesome.
like so thankful, and just she felt so much better about herself, and it was like
actually,
such a sweet story.
That's awesome.
Yeah, it was so sweet
It's
hearing
like the
about
beginning
it.
of the story, actually.
It is. It is. Yeah, we didn't even get started yet. We just did products.
But like you established the relationship.
Yeah.
And you somehow tapped into the humanity of her situation. And she felt that.
She felt so much better, and that's all she was hoping for.
That's what she wanted.
Yeah.
She was probably yearning for it.
Yes.
That's awesome, dude.
Yeah.
That's really
it was
cool.
really sweet.
I think that's a really interesting thing. Like, I'm happy you actually said that's wonderful. I'm happy to hear that. I think that there's a lot with that story, that short story in the beginning, like the beginnings of that total story, right? That says a lot about our place. And I think what sets us apart and what I'm really proud of is that despite us getting larger and opening new places and expanding and stuff, is that we've maintained this the relationship importance of our staff, our team, and our clients. And I think that's shown with I mean, when you walk in, you can just feel that. You know, like we know people's stories, we know people's families, and I think that's like super important.
It is
in the way that the world's going right now with just all medicine in general. And I think that especially in this like longevity medicine space, obviously we call it our life optimization, right? But if what this really is longevity medicine. It's us using different things that are sometimes really well backed by Western medicine and sometimes a little bit on the edge, but eventually will be backed by Western medicine. Us using our knowledge, developing game plans for those particular people that we know intimately. We know their stories. We know
exactly
why they're stressed out. We know what the stress consists of. We know the hardships they have. We know the wonderful things they have, right? The stuff that makes them happy. And then we can tailor things that lead to them having their best life, right?
Yeah. It's not a one size fits all.
No. And you can't get that when you have like private equity involved.
Right.
You can't get that if the doctor or the provider is not, is like, in an ivory tower, not even in the place.
Exactly.
Like, what's the point of that?
Yeah.
It's like, and then people spend money and it's like they get out of there. They a lot of times they don't even know what's going on.
Exactly. And I feel like a lot of people have if you go to big businesses like franchising and things like that, they all have the same settings for everyone or same patient skin type 3. You do this. Yeah.
They're like
and that's
robots.
all you have.
That's robots. Yeah. And you guys, I'm sure you guys have been to these types of places. And I think that, I don't know, man. I think that it's going to be, I hope that the world somehow the pendulum swings, kind of back towards the relationship thing. I think it's there, but I feel like we have such a fast pace anymore that people just want to go ba-boom, ba-boom.
Yeah.
And it's like, okay, it's good enough. We're good.
Exactly.
And, but guys, a lot of people so let me back up a little bit because this is an interesting topic and it's something I'm kind of passionate about. It might be coming out in my voice. I'm like,
I'm so scared of
I think about this. I know when I get like this, I think about this at nighttime. And it is kind of nighttime right now, so I get all deep and stuff like that. Anyway, I think about this where the medical field is getting more and more distanced, right, from the patient or client every year that I'm a doctor.
Yeah.
And I think that when I got into medicine, there was this really beautiful way that medicine was practiced. And it was there was this trust thing and relationship thing. And I still have that in my medical practice.
Yeah.
I truly do. But I'll tell you something, other than if you ask around, even just, regular doctors, this types of situation, aesthetic medicine, there's layers now between, that client or that patient in that chair and whoever's doing it.
Yeah.
There's no intimacy. There's no
there's not anymore. Even when I go to like the dermatologist office or any other doctor office. I never feel like important.
That sucks.
Yeah.
Yeah. That's not the way it was meant to be, I don't think.
No.
I don't know. I don't think many doctors that they get into this like wanting that to actually occur.
No, I don't think so
Jaded,
either.
I guess.
Yeah.
But yeah, it's not like something that nobody that I was in school with ever, would be like, oh, I can't wait to, be like miserable and not know who I'm taking. You know what I mean?
Exactly.
And that's not to say it's everywhere, guys. I mean, listen, there's lots of places that are actually doing the right thing and don't have all this nonsense. But it's kind of the time. It's how it is. It's how what's the function of the time? I guess that's the right saying. I guess. I
feel like everyone's like miserable nowadays too.
Maybe right now. Yeah, maybe. No, let's turn it up. All right. Everybody's happy. Everybody's happy. So anyway, but back to like what we're saying. And I'm going like rambling and stuff like that. Is that I think what makes our place different and what makes Maia's approach different is what you exemplified in that short story you said.
Yeah.
That was a kind of like a thing you're gonna think about at night. You probably tell your mom about.
Yeah.
And like she'll be like, wow, it's great. And then it makes you feel like you have purpose and you did something good.
It was really sweet hearing like her story and everything like that. And it gets
you excited for her to come in again.
Yeah, I know. We already.
You're like, I can't wait.
I know.
Yeah, and that's really cool.
Yeah.
I think that's like also different. People don't realize that. Like some of our clients, where when I walk in the room, I sometimes and you clients know who I'm talking about here. I'll light up and I'm like, oh my god, you know what I mean? Because it was I know the stories,
right?
Yeah, and it's like I'm part of it.
A lot of your patients you've known for
a long time,
so long,
like super long time.
Yeah,
it's really cool to see them.
Do you have any like nice stories recently? You probably have so many.
Man, I got that nice birthday card from that client. That was really nice. That was for her giving to me for like my own stories. Yeah. I'm like people give me all the presents all the time.
I know.
I'm so happy. Yeah, no, man. I think I do have some stories. Let me think about one. Yeah, dude. I have a good story. Yeah.
I really like
I
like the story of your patient that you took off of ADHD medicine.
Mm-hmm. That was cool.
Yeah.
Yeah, I decreased him into. So what's kind of cool. So that goes around the this whole inflammation thing that we talk about. That is something I've actually talked about this on air or on this cool podcast. One thing that I've noticed is when I've given GLPs, this tirzepatide, to people, they've actually gotten better with their ADD.
I know. I can't believe that.
It's crazy.
So insane.
I know. And I'm like, should I take some? But no, that was kind of cool. Yeah, that was cool. That's not my best one though. Hold on. That's
No, I know. I
know.
I could throw that in.
Yeah, you're like, oh, here's one. You gave me you threw a nice softball. I was like, I don't want to talk about that.
Well, we were talking about the life optimization.
We are talking about life optimization. Yeah, I think I had one client recently. Okay. She's a patient from the medical practice that wasn't getting the she didn't fit criteria fully. She should have, but man, this poor girl, she had such a hard time with insurance companies covering it and stuff.
Okay.
And man, we went back and forth, and just didn't work out.
Yeah.
But I'll tell you, Maya, I told the mom, and the younger girl, she's 18, 19, but you could see she was really struggling and having a hard time. And the mom was having a hard time because she didn't want to see her kid in pain.
Yeah.
And like just upset. And she came in, we were microdosing, very small dose, and 0 symptoms. And it was the first time, what she said to me? She said, I've never gotten on a scale and actually been lower.
Oh.
Yeah. And I was like,
so nice.
I was like, wow. And like
it's
that was
such a nice
win.
feeling.
That was a win.
It is.
And it was like just the beginning. It was our first appointment, our first one after we started. It was 1 week.
Wow.
Yeah. And that she was super happy, and you could see that she had hope.
Yeah.
And like was like, okay, and she like trusted that the plan I told her is going to work is going to work.
Yeah.
Because she's probably been given, plans before in the past.
I'm sure.
And like just didn't work out.
It's like nonsense sometimes.
Mm-hmm. Yeah. Or it's like impossible.
It is.
Like we've all been there where somebody gives us like a, some sort of thing to do, and you're like, dude, this is totally not going to fit in my lifestyle.
Yeah.
And that's like the thing. It's like, if you get to know somebody, you can kind of understand their lifestyle and then you can actually give them the right type of program and the right type of like advice and pathway for it to actually work. And I always wonder that about doctors, right? I always think about that with medications, actually. Because you ever get prescribed a medicine and you have to take it like 4 or 5 times a day?
Yeah. Well, no, actually,
like
that's never happened. No.
Never 3 times.
I don't think
In
so.
fact, the doctors, because they've thought about this.
Yeah.
That's good.
You're my doctor.
I know. All right. I mean, that's amazing. That's right. Well, that's probably why you've never experienced it. But there's a lot of times that I'm sure you guys are out there and your kids or yourself have given prescribed a medicine that's like kind of ridiculous. It's like hard to get. You can't find it anywhere. It's like 6 times a day. I'm exaggerating a little bit, but there's alternatives there.
Yeah.
And it's like I always think about that. I'm like why not just go with the alternative, and it go maybe once a day, twice a day.
Right.
You know what I mean?
Yeah.
Like make it easy on the person. Why do we make life hard?
Diet and lifestyle definitely changes a lot in everyone's life.
It's true. Do you feel good where you are now?
Yeah, I'm so happy where I am.
Great.
Thank you.
Yeah, man. And I think that's
Thank you so much.
That's important to show this as well. Is like when people lose weight and they get on this stuff, they think that they're going to look all weird and stuff.
Yeah.
But like you work out and then you eat well and look at you.
Yeah.
You look amazing.
Thank you.
Yeah.
Thank you. I feel amazing.
That's awesome. That's
I feel like myself again. I didn't feel like myself for like 3 or 4 years. It was like so sad.
And I would never have known.
I know.
Because you're always happy.
I know.
Yeah. I can tell. You have a different like vibe to you.
Yeah.
I mean, not that you had a bad vibe before.
No, I know. I don't. I didn't take it that way.
Yeah, I know.
Thank you.
That way. Yeah, you have a great vibe. And then it's also like the brightness, like the energy. You know what I mean?
My skin's great. I feel like I haven't had a breakout in a long time. Thank you.
What do you do for your your aesthetic stuff? I mean, we know that you've done the life optimization. You keep up with it a little bit here and there. Like we weaned you off of some stuff there.
Yeah,
but,
like other.
Yeah, what's your favorite? What are your favorite treatments? How do you get to look like you? Like look at you, right? Like how can a young lady looking out at Maia right now? Like what can they do for to get
full face tox is definitely my favorite. I try to keep up with hydrofacials.
So you get tox done. You get botulinum toxin done.
Yeah,
we use Jeuveau.
Yes.
Right. We love Jeuveau. But, and you're only 24.
I know.
How could that be?
I know.
Right?
I know.
But you move beautifully.
Thank you.
You're very welcome. And I don't think it looks like you get toxic. It just looks like you are genetically blessed.
Exactly.
And
it doesn't have to look crazy, everyone. It doesn't have to
look crazy, everybody. Right. If it's placed appropriately, you just look genetically blessed.
Yeah.
And that's, we might trademark that. Anyway, but that's okay. What else? I'm sorry, I interrupted you.
I've gotten lip filler done in the past. Okay. And that's pretty much it. I got IPL in the spring and I loved getting it. I can't wait to get it done again. I definitely have a lot of sun damage from the summer.
Well, you can do it on our Smooth Glow event.
I know.
And filler event.
I know.
That'd be kind of cool.
Yeah.
When's that happening?
October 15th. I'm so excited.
At the Voorhees office.
Yeah.
And it's going from 9 to 9.
I know. That's a long day.
I know. Everybody hates me.
I'm so excited.
We're doing 9 to 9.
No, you have to. You got to do it.
You gotta do it.
9 to 6. It's
9 to 6. That's like, ugh.
Everyone's at work.
We're just getting started.
Yeah. Dr. John, I always say Dr. John wakes up at 6 p.m.
I do get good at 6
p.m. And then he's
p.m.
ready for the rest of the night.
I am really great at 6 p.m. I don't know what that's about. I don't know. I hope to always hold on to that, but I know it's
I hope so, because he's like, some days he has a little rough morning. And then once 4:30 hits, I'm like, okay.
Yeah. But now I've been playing golf more. Not messing around. Nah, I mean, I've been trying to find ways to decompress. And to
needed something. Yeah. It's been too long.
I've been grinding.
He was on his phone, kind of brain rotting. Then he was like,
was I doing that?
Yeah.
Was I doom scrolling?
Yes. I keep hearing that. I've just heard that recently this week. I never heard of it before.
It's this thing, I guess, when you're scrolling.
I definitely do it. I'm not saying I'm not.
Your dopamine levels are getting all whacked out and stuff. Dude, this phone thing is the worst thing for you.
I know.
Seriously. It's literally the worst thing that possibly could have happened to humanity is the phone and also social media.
I know. I'm going to start saying that when Dr. John wants me to post on Instagram, say it's really bad for me. I
know.
Can't.
Isn't that funny? I'm like, guys, are you posting? I know. As I'm that's so funny. Yeah, but the working hours. Okay. Forget about it. Anyway. So, what was your question for me? You asked me, did you ask me something?
I don't think so. What do you get done? You asked me what I get done.
Oh, nothing. No, I get, honestly, I get tox here. And I get it here when I start looking loosey-goosey.
Yeah.
I don't like that. And then
I love Nectox.
Nectox is the best.
It's amazing. I need it.
You know, you actually shot some Resurfix at me.
Oh,
That one time over here.
say that.
No, I gave consent. It was okay. I had my hand there. Anyway, now I'm messing around. No, just kidding. No, you give me hydrofacials. I get hydrofacials from you.
Yeah.
Lenny gives me hydrofacials. Dana's giving me a hydrofacial.
Yeah.
You gave me a really great hydrofacial. Last hydrofacial I had.
Yeah.
That was a great one.
Yeah.
Yeah.
You're definitely due for it. Maybe we
You're
could do that on
seeing me? Are you
Tuesday.
looking at me?
No.
Are you judging me on his life? Yeah. I know. I always feel judged. No, I was messing around. No. What else do I do? I started the life optimization program myself.
That's right. I haven't like followed up with you on that. How do you feel?
I'm feeling pretty good. We just started. I just started the dad stack.
What's that?
The dad stack?
What is that?
You didn't hear about this?
No.
Oh, it's something I came up with
Okay.
like a couple days ago. Honest to God. And the dad stack is awesome. It does, honestly, it's going to change men's lives.
What is it?
I'm going to tell you about it. I'm going to tell you about 2 seconds.
Okay.
The dad stack, okay, is a combo of particular peptides. Okay, that I've curated.
Okay.
It's like making a soup. all
Okay.
right? You know how you make a soup and you have to have certain base to the soup?
Yeah.
So now I found the base for the perfect peptide blend for dads, 30 to 50.
Okay.
Honest to God. Like, truly. Fantastic stuff, okay?
Mm-hmm.
It's called the dad stack.
Okay.
And from there, we curate the dad stack to whatever other needs you might have. So, for instance, if a man comes in and we're talking, right, we're chatting it up, he's talking to me about what his goals are. I'm hearing about his lifestyle. I'm hearing about different things that are bothering him, and we can make it customized to him. So you start with the base of the soup,
Okay.
right, and that's customized peptide. I can't talk about that
Okay.
in detail because I don't want anybody. I haven't trademarked that yet.
Okay. That's
All right.
awful. It's offline.
I can't. Yeah, offline, I'm going to tell you. Well, you're going to have to know about it because you're going to
Yeah, I'm gonna have to tell.
check it out.
I'm gonna have to tell people to get the dad
but
stack.
this is honestly a game changer because no one's. I guess this is where that relationship comes in and we're tying it all together, baby. You thought we were all over the place, but we had a plan here, but we're tying it all together because with that relationship building that we do, we're able to curate things really, really well
Absolutely.
for people. Okay. And the women, man, we spend a lot of time on the ladies, and we're gonna keep spending time, you guys. Like you're not going nowhere. Like we got you, but the dad's got to get some love.
Yeah.
And I got a lot of men messaging me.
It's their turn.
It's their they got to be part of the conversation. And honestly, the girls are looking good.
Yeah.
And they're tired of looking good, so good, and their hubby's not looking that good.
Yeah.
You know what I mean? And then I'm like, listen, bring them boys into me. I take care of them. We get them all ripped up, baby. And then, everybody's happy.
Yeah.
Anyway, back to the dad stack. So dad stack starts with a customized peptide
Right.
blend.
Okay.
That then can be further customized and added onto with other things that might be needs of our client based on the conversation, based on the relationship.
Right.
Really deeply knowing these people.
Okay.
And also we do the body scan on them. We can really get objective data on where they are. And then I can weigh in on that. Like, hey, listen, your body fat percentage is this. This is what we got to do.
Okay.
Well, one of the things that I'm happy that we're incorporating now is testosterone therapy.
Yeah.
Hey, man.
That's huge.
That's really big. And listen, if you guys, if you know anybody that was had low T and then got their T up, different man, different father,
yeah.
different husband, different employee, different employer, sometimes your boss, right? They're just happier guys. They're doing better. They're back to their old selves. So that's one thing we incorporate. We can incorporate other things like glutathione into that the dad stack peptide blend, NAD. The sky's the limit.
Yeah.
And
we have it all.
It's really cool, man. I'm really excited. This is our newest thing. You heard it here first. I didn't even know I was going to talk about it. I didn't even know I was going to talk about it. Tyler's our media guru. He's like, shut up. Don't talk about it. No,
I know he had his own plan.
Actually, he was in the back like with a whiteboard, like dad stack, dad stack. Now, but the dad stack's gonna be it's gonna be launched. It's actually already launched. I already did it today for a man.
Oh, that's awesome.
He's part of the dad stack program.
That's
the
so
men's
cool.
program, the Garden Medical Spa.
I love that. I love the name.
You know that we've talked. I mean, I've been thinking about this for a long time. I know
this has been talked about for probably 2 years now, honestly.
It's been in my brain for 2 years.
Yeah.
I've been marinating this.
You have been.
I've been marinating this for 2 years. And I had an epiphany.
Yeah.
You know how I had the epiphany?
How?
I was at James's, my youngest son, his soccer practice, soccer game.
Yeah.
And I just so happened to be there. It was Was it Thursday? When was it? No, what's today? Today's Thursday.
Today's
I'm
Thursday.
sorry, Tuesday. I'm never around on Tuesday. You know why? Because I'm usually in Northfield, but I wasn't in Northfield. Maya's pretty bad about it. She's like,
so mad.
But I wasn't in Northfield, but guess where I was? I was at James's soccer.
Okay.
So at that soccer game, I was talking to other dads. Because dads are always at these things, right?
Yeah.
And I'm never there, so I don't get to talk to these guys. And you know me, how I always talk to everybody, and I talk about like different. I almost use people as like what do they call, like marketing testers?
Yes.
So I like test some ideas,
like network
in conversations.
Yeah.
In conversations. So I'm talking about these things, and every guy I talk to, they're talking about how they want a more comprehensive like plan for themselves. They're tired of like going on the internet and finding these.
Yeah, you're hearing 10 different things.
Yeah, or they go order something. What the hell do they know?
Right.
It's your body, guys. It's your body. You're gonna go and like trust some like person behind a screen that you did some Fugazi consult with, and then you're gonna order something, and then you're gonna inject yourself with something that the guy on the computer told you to. You don't even know who that person is. They might be very weird. You don't know who that is. At least that, like, make a good judgment based on who you're looking at. Right. I'm like, it blows my mind, and they don't even get good like blends of stuff. Like they're like, it's like some just basic nonsense.
Yeah, like diluted.
Crazy. No, it's not even diluted. It's just like it's like they just some guy came up with it and was like, oh yeah, this is for you.
I know. I want to know like where they make these things at.
Yeah, I mean they're legit. They're legit, but it's not.
Okay.
I don't know. I mean, well, not all of them are legit, but it's like I always wondered that, like, what seems to be out there right now are these online entities where you have some Fugazi consult or even like big business feel consult, where you don't even know what the education is of the nurse practitioner that you're like, she might have been practicing, God knows what, like 2 months ago, and now she's the director of of the whatever. I'm not going to say the name of it. But and it's like that's not it. That's not it for you. It's your life. It's your life. It's your life. It's your kid's life.
Yeah.
It's
your
you.
body.
It's your body.
Yeah.
And you're gonna like put weird stuff into it that you have a relationship with the person.
Exactly.
Like, what? Anyway, okay. I'm passionate about that.
Yeah.
So back to what I was saying. What was I saying?
When you were networking at James's.
Thank you. You're keeping me on track. This is why I love being in Northfield, because you keep me on track. So I'm at James's soccer, and I'm chatting it up, and they're telling me about their stuff, and they're like, "Yeah, dude, we want to get into this peptide. We heard about this. We heard about that. NAD, glutathione. Oh, you do? Wait, what's going on over there?" I said, "Well, let me ask you something. What are you guys interested in?" Everybody's like, "Oh, I'm tired. I'm grinding."
You're like the drug dealer at the soccer game.
Yeah, but good drugs.
Good drugs.
Good drugs.
Yeah.
Not like ketamine.
Oh my God, no.
Yeah, Maia. Anyway.
No,
But if you want some ketamine, not
yeah, right.
Nah, none of that. No. I'm like the peptide drug dealer.
Yeah.
For dads. And so I'm chatting it up, and the guys are telling me about they're pretty much telling me the same story, man.
Yeah.
It's like they're all my age, 42, got like 2 or 3 kids, sometimes 4. Back to school. Everybody's stressed out.
I know.
Running around. You know what I mean? The house, everything. It's just craziness.
Yeah.
You know what I mean? Money, sleep. Wife saying, take you out to dinner. It's all nuts.
The list goes on.
The list goes on. So I asked them, I said, what if there was something out there for you where it was like curated exactly to like what the needs are for a man in your situation right now? And like, with results, like no bullshit, like no fluff, just results. And they're like, dude, are you kidding me? I'm like, that would be awesome, right? Like, what if there was a path? Like, you didn't have to think about it. You just had to like trust. I mean, you either have a relationship.
Yeah.
You just took that relationship, you use that trust we have, and then we actually move forward. And they all were like, hell yeah. And I was like, yo, I'm gonna call it the dad stack.
Yeah.
And then when I said that word, everybody's like, yo,
I love that.
That hits.
That's going to hit so hard.
Thank you for saying that.
I'm excited for this.
The dad stack.
It's going to be great.
I know. It's
like
gonna be
what
really
we needed.
Cool. Yeah. Thank you so much for saying that. And there's other things. I might even get into it, or it's like the soon-to-be dad stack.
That's cute.
The soon-to-be dad stack, right?
Yeah.
It's like not for nothing,
you have to
guys.
Prepare.
Are you kidding me?
I mean, who am I to say that?
You have to prepare those sleepless nights.
Yeah.
NAD. NAD, right?
Yeah.
The sky's the limit. So anyway, I guess it's like super exciting. I'm pretty passionate about this stuff. It's fun. It's cool. I like to hear stories. I've always liked to hear stories. I always like to be part of, I don't know, the story, I guess, and part of people's like the good parts of their life.
Yeah.
You know what I mean? Like, it
it's
gives
like
me
a feel good
purpose
moment.
and, it gives you, I don't know, man. It is cool. Actually, okay, can I tell you a story?
Yeah.
All right, I'm gonna tell you a story. This is the one that just came in my mind. This is not a medical spa patient.
Okay.
So in my medical practice,
Okay.
I'll tell you, but it has something to do with medical spa too, sort of. I had this dad, really big guy, like really big guy.
Yeah.
And he was younger than me. He was like 39.
Okay.
But he didn't look younger than me. He looked a little older than me, and he had 2 young kids, and I was taking care of his kids, and we built a relationship, like we built a trust thing with each other, through that process, and we knew each other for about 9 months, maybe a year, maybe about a year. We bought a bunch of visits, man,
Yeah.
and he would always bring the kids. He was always with his wife. Really good guy. And I said to him, I said, hey, this is a tough one. I got done the exam kind of quickly, and it was easy. And then I kind of switched gears. I said, I wanted to bring something up to you, but it's a hard conversation to have.
Yeah.
But I think that we have this thing, this relationship between us where I can actually say this to you now. And I said, I think you have to start taking your health and your weight really much more seriously for you to be around for your kids in 10 years.
It's so important.
And I said, I don't think you will be. I said that to him. I said, I don't
That's
think
tough.
you will be. And I said that, I told him that I don't think I said, even if you are, you won't be there how you want to be there.
Right. Yeah.
You're not going to be functional.
No.
And someone's going to have to roll you around, and that's not how you want to live.
No, that's a shame.
And how you want your kids to see you. And I honestly think I was probably the first person to like take time and like have that conversation.
Yeah.
And, especially that he trusted.
Because it's such a tough conversation to have.
And I'm not his doctor. I was not his
Right.
doctor. I'm just his friend.
Yeah.
I was just his I'm his kid's doctor, right? I'm not.
Yeah.
I wasn't his doctor. And I said, I said, I need you to go to your doctor. I'm like, I know you have a doctor. Just go to him. And I wrote down what I wanted him to ask.
Yeah.
And he met criteria, of course, for Mounjaro.
Okay.
And now, I mean, that was about 9 months ago.
Okay.
And he's lost like 100 pounds.
That's amazing.
And his wife told me, because I saw her, and she goes, he works in Philly.
Yeah.
And she said it was the first time he was able to like walk to, from, like I guess he takes the train in.
Yeah.
And it's from like wherever he was able to walk and not have to like, require transportation of some sort. He was able to like literally walk, and he was like this basic thing that nobody, that was huge for him, man. What like a huge win. And he probably like maybe he thought to himself it was like that was it, dude.
Yeah.
Like, he maybe not going to be able to do that ever again.
Wow, that's such a like feel good.
But
story.
that's like was the power, I think, and like when I realized, and that wasn't when I realized it, but it just kind of like reiterates in my mind that
it's like a reminder
of why we're doing this, who I am in this position, who you are in this position, and like the influence we have and how sacred that is and how important the relationship is.
Yeah. And I feel like a lot of people think that these type of medicines are just for like skinny people that want to be skinnier or like things like that, but it's definitely
or like there's just like whack
it.
jobs that are like they're like obsessed with this one stupid thing. They're like that. There's people like that,
No, I'm not saying there's not, but it's like definitely more to it than just
in the right
that.
hands, man. In the right hands, then you're gonna get a much different look and vibe to what this thing can actually do for you.
Yeah.
And I always say it's like medicines act differently at different doses, and when used and when prescribed by different people.
Yeah. And I was telling you that I felt like bring back the constipation again, but I felt like everything was like better. My gut was better being on the microdose
Is that
versus
crazy?
not. And
every girl, dude.
Every symptom is like the opposite. Like
every girl says this. Number one, every girl that goes on microdose tirzepatide with us, their poops get better.
Yeah.
I'm just saying. And then what do you hear online? oh, it's going to cause constipation.
Yeah.
Like everybody talks about that.
Yeah.
That's at the higher doses. Mm-hmm. Crazy.
Yeah.
Amazing. But that's, this was nice. I loved having you on.
Thank you. I loved being here.
Giving insights and your story.
Thank you.
Yeah. And look forward to having you again on here.
I know. I'm
Always a pleasure.
excited. When's the next time?
I don't know. Maybe like a couple months.
Never.
Yeah, like I'm like, no, we'll call you. Anyway, Maia, well, it's a pleasure. I'll see you.
Thank you.
I will see you next Tuesday.
Yeah, if you show up.
I'll be there, Maia. Till next time, guys. Thanks for
Bye,
tuning
guys.
in and being a part of our podcast.